This skill is the upper bed bath. So I'm gonna wash hands, knock knock. Good morning, my name is Xavier, I'll be your CNA for today. Is it okay if I check your wristband? All right, Meredith Gray. So I'll be helping you with your upper body bed bath, is that okay? So I'll be back with the supplies. So I'll wash hands, I'm gonna grab my supplies. I'm gonna raise the bed up to a comfortable position. And I'll lower the side rail. So I'll put on my first set of gloves. And one of the key points for this skill is just making sure that the patient is covered at all times to promote privacy as well as dignity. I have 3 towels. I'm gonna place one over the chest. I have another towel that I'm gonna place underneath the head. So can you please raise your head for me? And another towel underneath the arms. So the first thing I want to start with are the eyes, and we're just going to use regular water, just 105-degree water, no soap for the eyes. So we're going to create a hand mitt. So just kind of hold it like this, using the thumb in place, and then wrap the towel. So I have water, and then I'm going to start with the inner eye and outwards, so the farthest eye from me. And then I'll rinse it again. Would you like any soap on your face? So they'll say yes. I get some water, some soap, and then we're going to clean the face like this, like a square. I'll rinse, again like a square, and the last will be the nose. We're going to proceed to do the neck and behind the ears. So water, soap, behind the ears and neck, behind the ears and neck, rinse. And then we can also pat dry. So I didn't do the face, so I'm going to pat dry the face and also the neck. And then we're going to go over the chest. So lower the bath blanket underneath. We're going to expose just the chest only, cover the rest of the body. Using the same towel, make a hand mitt, water, soap, do circular motions. If you clean under the breast, you're going to clean by pulling your hand the other way, using the back of your hand, and then cleaning underneath, because underneath the breast there could be redness, there could be areas where there's inflammation. So use the back of your hand, do one swipe, and then we're going to rinse. Same thing underneath the breast. And then we're going to pat dry. We're going to lift up the other side, the other corner. Again, checking for skin folds, redness, anything unusual. So water, soap, rinse, pat dry. I'll do the same thing on the other side, the other chest, the other abdomen. And then from here, we're going to do the arms. When you do the arms, again, just try to expose one at a time. Start with the shoulder and armpit, then the upper arm, then the lower arm, and the last will be the hands. So I'm going to do the side closest to me. So we'll start with the shoulder and armpit. And if the water becomes soapy or cold, I'll just change that. Water, soap, armpit, and also the shoulder. So rinse, shoulder, armpit, pat dry. I'll do the upper arm. So as you're doing this, check for any redness, any unusual abnormalities that can be in the skin. Water, soap. Can you please raise your arm for me? Rinse, pat dry. So use the towel that's underneath. Water, soap. Can you raise your arm for me? Rinse, pat dry. Once I reach this part, I'm going to put this into the hamper. I'm going to go ahead and stop, and I'll tell the nurse that I'm going to go ahead and change my water and change my gloves. So at this point, I have new water, and of course we always want to have the patient test the water for safety, so it's fine, and it's 105-degree water. I have new gloves, and I have a new washcloth. So with this one, we're going to go ahead and we're gonna put water, put some soap, clean the hands, do it very carefully. This goes into the hamper, and we're going to take the basin and we're gonna soak the hand for about 3 minutes, because the hands tend to be the dirtiest. So for 3 minutes, we're gonna go ahead and rinse it off. We're going to pat dry, and I'm gonna do the same thing on the other arm and the other hand. So from here, we can remove all the towels, so please raise your arm for me. We can go ahead and raise this one on top. And please raise your head for me. We're going to remove the gloves, garbage, and I'm going to raise the side rail for safety. And we're going to lower the bed to the lowest position. And that's for the patient's safety. So from here, we're gonna put on the last set of gloves, and we're gonna clean up. So I'll dump out the water, rinse and dry, put the soap in here. Any supplies that I haven't used, they go into the hamper or the trash. And I'll clean up the supplies and I'll put it in their personal belongings. Remove gloves, wash hands. Mrs. Gray, was there anything else that you needed? So here's your call light, your phone, tissue, water, and magazines. If there's anything you need, I'll be right back. So I'll go ahead and open the curtains, I'll wash my hands, step outside, record, and report.